Hey everybody, Luke Gordon here with Gordon Physical Therapy, and today we're talking about total knee replacements and what you can do leading up to your surgery. So when most people think about having a total knee replacement, what they tend to think about is what they're going to do after the surgery. What are they going to do? How are they going to get home? What's the rehab going to look like? Who's going to help them out? Things like that. So a lot of preparation and planning goes into it because it's a major surgery, and so it makes sense to focus on those things. But what oftentimes gets skipped is what you could be doing right now in the weeks and months leading up to your surgery. So that's the topic of today's video, today's blog post, is what are some things that you can do, in the 1 to 2 months leading up to your surgery to really maximize your recovery. And statistically speaking, there's studies that show that people who do what we call prehab or prehabilitation prior to their surgery have a 29% reduction in the cost associated with their surgery, and they have significantly lower likelihoods of having to go to a nursing home or a skilled nursing facility or like an inpatient rehab facility. So it's definitely worth it if you're going to have a total knee replacement to put in some effort and some research leading up to the surgery to just give yourself the best chance that you have to make a really quick recovery, get off your pain medications quick, and with any luck stay out of the nursing home. So in today's post, this is the first of kind of a series that I'm going to do. We're just going to talk in generalities for the most part. I'm not going to get into the specific exercises and stretches yet, but I will on the next one. So for this one, I just want to cover the 3 essential things that you want to cover before your surgery. So again, consider this like your prehab phase. So the first thing you want to do is get your knee as flexible as possible. So following surgery, when people come to us for post-op, outpatient rehab, one of the hardest things you're going to deal with is getting your knee to fully straighten or extend and to fully bend. So it makes sense then that going into your surgery, the more flexibility, the more motion you have there, the easier it's going to be for you afterwards to regain all of that back. So that's your first thing. Work hard to regain that flexibility, or if you already have it, just work hard to maintain it. And again, no specifics right now, but next video there will be. The second thing you want to do is you want to strengthen your quad muscles as much as you can. So the quad muscles, quadriceps muscles, are the biggest set of muscles in your body. It's the one that's on the front of your thigh leading up to your knee. What happens is before a knee surgery like this, typically they're weak and they're atrophied, and you don't have very good control of it. And then during the surgery, because it's so traumatic and there's so much swelling and pain and irritation, is that basically that muscle gets turned off. So then when you go to start your rehab, you have to take the first couple weeks just getting the thing to turn back on so you can use it. And then you can start to build your strength and start walking more and things like that. So going into your surgery, it makes a lot of sense to get as much control of that muscle as you can. So work that muscle. Again, there's some exercises I'm going to share with you in the next video. But do whatever you can to get that quad muscle firing and get good control of it. That way when you go after your surgery, it's going to be that much easier to turn back on. So those are the first 2. The last one that I'm going to cover right now is you just want to stay active. However you like to stay active is great, but overall, we're not just talking about your knee when we're going into surgery. It's your whole body that's going to be, kind of feeling down and out. You're going to rely on your arms. You're going to need strength in your hips and your ankles. And for a lot of people, unfortunately, when they're leading up to a total knee surgery, is that the pain has gotten so bad that activity is just, it's too difficult or it's too painful. So then what happens is everything in your body gets weak. And you can imagine if you were stronger going into your surgery that you're going to have a much easier recovery. So simple things you can do. If walking is still comfortable, go ahead and go for some walks. If it's not comfortable, then go ahead and do things like walk in the swimming pool, exercise in the pool. That's one of my favorite things to do. Or ride like a stationary bike. So anything that you can do to stay active, however it works best for you. So those are your 3 essential tips to do leading up to a total knee replacement, also called a total knee arthroplasty in our world. Do these things to help yourself have a quicker recovery, avoid what we call stiff knee syndrome, where your knee tightens up more than it should, and just have a better, easier recovery. So those are things that you can follow. Again, in the next blog post and video that I'm going to share with you, I'll cover some more of the details so you can actually implement this at home. And what we're going to build up to this as well is that if you have specific questions, you're more than welcome to leave them below underneath the video, or I'll leave my contact information so you can call or email me. But also what we offer is if you're having a total knee replacement in the next 2 months, we'll end up offering you a free prehab visit, so it'll be a free 30-minute assessment. I'm going to talk more about that in the next video, but anyways, start with those things. Start wrapping your mind around this idea that what you do leading up to your surgery is very important and that it's going to help you with your recovery. Thanks for watching. I just thought the video didn't turn on. Thank you for watching, and let me know if you have any questions. Thanks.